Today, I'm going to be performing a virtual carotid endarterectomy. This procedure is performed to remove blockages in the carotid arteries to reduce the risk of stroke. I will perform this surgery using my surgical simulation program, which real surgeons use to learn techniques. The program will ask me questions along the way, and I will perform the surgery. I'm going to do this all by myself. First, the patient is placed in supine, and the shoulder pad is put under their shoulder for better visualization. Now I'm palpating the superficial temporal artery pulse. Now I'm going to take a marker pen and mark the anterior border of the sternocleidomastoid muscle. These are the main two muscles that run up the neck. Now I am going to clean and drape the patient. Now I'm going to take a Lobin, which is a sterile plastic adhesive, and place that over the operative site. Now I'm going to take local anesthetic and I'm going to infiltrate the incision to help with postoperative pain. Now I'm going to take a scalpel and mark our incision site. Now I'm going to take electrocautery, which is a little pen that produces heat that cauterizes the skin and prevents bleeding. And I'm going to dissect through the subcutaneous tissue until I counter the platysmal muscle. Now I'm going to take the same electrocautery and I'm going to incise the muscles. Now I'm taking two self-retaining retractors. These are little retractors that retain themselves so you don't have to hold them. I'm going to place one cranially, which means towards the top of the head, and then I'm going to place the other one caudally, which means towards the base of the head. Now I'm going to take sutures and I am going to tie off any surrounding veins and the facial vein. This is to prevent injury during the procedure. Now I'm going to take scissors and I'm going to divide these veins. Now I'm going to expose the carotid sheath further by expanding my retractors. Now I'm going to use the Kelly clamp and the electrocautery. This is going to open the carotid sheath. This is where the carotid artery is. Now I'm going to identify the surrounding nerves. It is important to do this so we do not cause injury during the surgery. I'm going to take my scissors and I'm going to dissect the vagus nerve free from the carotid. Now I'm going to take vessel loops. These are little strings that can tie off vessels. I'm going to loop off the superior thyroid artery and the ascending pharyngeal branch. Now I'm going to take the same vessel loops and tie off the external carotid artery. I'm going to do that again to the internal carotid. Now I'm going to confirm hemostatic field. This means that I make sure that there's no more bleeding. Now I'm going to take my marker pen and I'm going to mark the arteriotomy. This is going to be where we cut the artery. Now I'm going to take heparinized saline. Heparin is a medicine that causes anticoagulation, which will help with the bleeding. I'm going to administer heparin and I'm going to wait 5 minutes for it to take its effect. Now I'm going to take an aneurysm clip and I'm going to apply that to the internal carotid artery. These are little clips that are usually used in the brain, but in this case they can be used to clamp the carotid. Now I'm going to take a bulldog clamp, which is a large clamp, and I'm going to clamp the common carotid artery. Now I'm taking another aneurysm clip and I'm clamping the external carotid. Now I'm going to take my 11-blade scalpel and we're going to do the arteriotomy. I'm going to take this and I'm going to go inferior most and I'm going to incise the artery. Now I'm going to take pot scissors, which are little scissors that are curved, and I'm going to extend beyond the plaque. Now I'm going to take forceps and I'm going to grab the lateral edge of the incision. This means the far edge of the incision so I can stabilize it. Now I'm going to take forceps again and I'm going to grab the lateral edge incision of the plaque inside. Now I'm taking a number 4 Penfield dissector and I'm going to dissect through the plaque. I'm going to go lateral to medial. Now I'm going to take the forceps again. And I'm going to cut the proximal end of the plaque. Now I'm going to take the number 4 Penfield dissector again, and I am going to dissect the plaque to the external carotid. Then I dissect the superior aspect of the plaque into the back wall of the artery. This just means that I am removing the whole plaque from the whole artery right now. And I'm going to go ciliac. Now I'm taking the pot scissors again, and I'm going to continue to remove. Now I'm going to take 6-O-proline suture and tack down the margin of the plaque with a 4 to 8 o'clock technique. Imagine if it was a face of a clock. I would put a suture at 4 and at 8 o'clock. Now I'm going to get a syringe with heparinized saline and I'm going to wash out the arteriotomy to remove any small pieces of plaque. Now I'm going to take 6-O-proline suture and I'm going to start to close the carotid. Now I'm going to remove one of the aneurysm clips and I'm going to check for brisk bleeding. If there's no bleeding, that could indicate thrombosis, which could cause further complications. Now I'm going to take heparinized saline again and I'm going to wash the arteriotomy site. Now I'm going to continue to close with 6-O-proline. Now I'm going to remove the clips from the external carotid and the vessel loops. I'm going to do the same to the internal carotid and the common carotid. Now I'm going to remove the ties from the other vessels. Now I'm going to repair the arteriotomy as needed to make sure that there's no bleeding into the neck. Now I'm going to irrigate the field again. Now I'm removing the tractors and the loben. Now I'm going to take the 10 French drain, which is a drain that will let the fluid drain out while the incision is healing. I'm going to place the drain into the field. Now I'm going to take 6-O-proline again, and I'm going to close the plasma layer. Now I'm going to take 6-O-proline again, and I'm going to close the subcutaneous tissue with inverted interrupted sutures. Now I'm going to take 6-O-proline, and I'm going to close the skin with running subticular sutures. Now I'm going to take sterile dressing and I'm going to dress the wound. And now we're done with the surgery.